Connecticut Children's Medical Center was formed 20 years ago, and since then we've seen programmatic development of this institution to be one of the premier children's hospitals in the state of Connecticut. AHRA is a community, really, and as we look at the different offerings of this program, when the solicitation came up for applications for this program, I knew immediately that we had a great idea. In fact, this is a brainchild of one of our technologists. So we have a very empowered environment where one of our technologists came up with the idea of creating videos for our patients. And so we took that idea and ran with it.
So in the past, when we provide patient education, it's either sitting down with them or we provide them paper education. With this avenue, children are going to be able to see children experiencing this and learning. Parents are going to be prepared by seeing the content at their education and knowledge level, so they're prepared to really prepare their children pre-procedure, which is wonderful.
The Toshiba-sponsored grant through the AHRA of Putting Patients First has been a great opportunity for us to develop these modules, which I think will be very helpful for children and families coming in for procedures. And I certainly recommend that other hospitals consider applying for these grants as well.
I truly believe this is going to be a huge win for our children and families. When you look at exceptional experience, you have to put into place safe care, quality care, satisfying care, and Putting Patients First is just going to be one entity to help support that.
Community Wellness Center. It started 4 years ago to help underserved in the community, mostly given medical services. We also address homelessness, nutrition, and other services. The Putting Patients First with Toshiba, the radiology students had really initially brought it to our attention, and the Community Wellness Board was very enthusiastic to expand.
The plan for the program is to have an X-ray machine that is movable so that those who can't make it to our clinic, can't make it to a hospital for an X-ray exam, we're able to come to them. Just pull up to the curb, and that's pretty incredible.
Putting Patients First program, I think, is a great grant that is really helpful for us to be able to expand our clinic outside of a clinic basis, being able to be mobile. There's not a lot of programs that are nonprofit and are able to have the mobile units, so it's awesome that we get to take advantage of it and go somewhere with it. And I hope that in the future that we're able to reach out to this program again and have a second or a third mobile unit.
I want to thank AHRA and Toshiba for allowing this grant. Patient safety is really needed in the community, and Putting Patients First is unique because there's not that much patient safety grants out there.
Our institution comprises UF Health Shands Hospital, which includes both the adult and the children's hospital. We have over 1,000 beds and are ranked nationally in 9 subspecialties of care. What inspired me to apply for the Putting Patients First program was really working with our clinicians and coming to learn that they didn't really understand what fluoroscopy was, or why we performed fluoroscopic studies, or how much radiation was actually involved. So I wanted to create an educational program geared towards our clinicians to teach them about fluoroscopy, how we perform studies, and how much radiation is in fact involved in these studies.
Children are prone to get more radiation exposure and more radiation hazards. Literature has proven that if we minimize the radiation, there is a lesser chance for harming the patients. The first principle we have as a doctors is do no harm. At UF Health Shands Children's Hospital, we make sure that we always practice that. Now, taking a step ahead, we decided to educate the clinicians and the fluoroscopy personnel to understand do no harm means do less radiation.
I think it's great to see an organization such as the AHRA provide grants like this to hospitals, because it really shows the commitment of the organization to not only medical imaging, but to patient safety and care.